COVID case numbers have changed very little over the last 2 weeks, but experts say cases are significantly undercounted or they're not being reported. So here to talk about that today with us, Chief
Meteorologist.
I'm looking at him.
You guys can switch. Dave, you can be a health editor.
But really, I mean, cases being undercounted, Dr. Nandy.
Absolutely, and Glenda, here's what's going on. Experts are tracking cases, and they say that they're in fact being undercounted, and there are a couple of reasons for it. One, people with milder symptoms may mistake the infection as a cold and think it's not important to get tested. Secondly, Americans have access to home tests, and a good chunk of those results, guess what, are not being reported to health departments. So it's becoming harder to know for sure really how prevalent COVID is right now in our communities. But despite the fact that our case counts are not as reliable as they've been in the past, they are still useful in my opinion. 26 states are seeing rising case numbers, Glenda, with a few reporting spikes. Nebraska's up, get this, almost 80%, Arizona up 75%, and New York 58%. To me, it's really important that people are aware that we are not catching every infected person, and numbers are likely higher than what's being reported.
So then how do you tell how widespread the virus is if these case numbers aren't being counted accurately?
And that's a question, but we have to remember, Glenda, that even when case numbers are low, there is no guarantee that a person would not get infected. Omicron subvariant BA2 is highly contagious and now accounts for 72% of cases here in the U.S. People need to assume that it can be anywhere. But there are a couple of things that people can do to assess risk. One is to keep an eye on hospitalization numbers. Just remember that hospitalization numbers lag behind cases. Secondly, you can visit the COVID-19 community level map on the CDC website. Very useful. You enter a state and county, and the site calculates the community risk using case counts and hospital admissions and tells you if your risk is low, medium, or high. Lastly, and likely the most important thing you can do is to assess your own personal risk and those who live with you. The people most at risk are those who are immunocompromised and children under the age of 5 because they are not yet eligible to get vaccinated. However, CDC also points out that older age and certain underlying medical conditions are associated with a higher risk for severe COVID-19. For example, diabetes. I have people in my family with diabetes, heart conditions, kidney and liver disease, and obesity, to name just a few. So please, if you or your loved one are at risk, do not take chances. The virus is not vanishing. We will quite likely continue to see surges, and they may be harder to detect due to milder symptoms for some folks and home rapid tests, which are not always reported. And I'm still very careful because my mom has diabetes, and I have a child that's less than 5. So just kind of follow your own risk guidelines and act accordingly. But we know, get vaccinated, get protected as much as possible.
Because we still see you wearing your mask, even in here just now.
Right over there, exactly.
All right. Well, Doc, you bring the sunshine with you
Thank you
when
so
you
much.
come. Thank you for the update. Appreciate it. If you have a coronavirus question for the good doctor, you can email him at drnandy@askdrnandy.com. Send it to us on Facebook or Twitter. We'll get it right to him.